Thank you. I call Jim Fairlie, last speaker in the open debate.
Thank you, Presiding Officer. I'd like to start by thanking the numerous organisations and individuals who gave me their time and expertise while I researched for today's debate. There are far too many of them to mention, but each contribution has been hugely helpful and equally as humbling in the work and effort they are putting in to help those affected by addiction, especially over the period of the pandemic. So why do people take drugs in the first place? That's a bit like asking what colour are cars. The reality is there is no single reason, which simply means neither is there a single silver bullet cure. In my own constituency of Perthshire, South and Kinrossshire and the wider Perth and Kinross Council area, there has been an increase in usage and drug-related deaths over the pandemic. But there is also some fabulous joined-up working through multi-agency collaborations like the Alcohol and Drug Rehabilitation Partnership, who made it clear to me that they are committed to delivering the aims of the National Drugs Mission. The scope and scale of the work they are doing is brilliant and far too big to discuss all in a 4-minute speech. But I think it's important to say that the partners in the ADP include Perth and Kinross Council Social Care Partnership, Perth and Kinross Council Children's Services, Housing, Justice Services, Local Police Scotland, Public Health, Third Sector Partners and the Scottish Prison Service. And as part of the Scottish Government's £13.5 million uplift to ADPs, this year Perth and Kinross ADP is to receive just under £400,000 and then a further £180,000 to be used in the outreach and near-fatal overdose pathways and living experience panels. Yes, very quickly.
I thank the member for taking this intervention. He, I'm sure, has heard concerns from these partnerships about the proposed centralisation of them under the National Care Service. What representations has he made to ministers about that?
Jim Fairlie.
Let me come to that. That's an example in my constituency of the nationwide effort that the Scottish Government are committed to. Now, I spoke to Stephen Jarden of the Scottish Recovery Consortium, who praised the £250 million funding package, with £100 million of it ring-fenced for residential rehab. And every bit as important, the aftercare and provision to ensure supported continuum so that after R&R folk aren't just dropped back into the drug-taking environment without the necessary support. He spoke of how pleased he was to have met the Minister Angela Constance and heard her plans and her full understanding of the real lived problems, which gave him real hope that we are tackling this hellish problem with the right approach. There is undoubtedly still much to do, but when the people who have lived with and come through addiction tell me that they're optimistic about our Minister's handling of the situation, that gives me a lot of hope too. Which brings me neatly to the Conservatives' motion. They seem to be all over the place on how to address Scotland's problem with substance abuse. In the short space of 4 clauses, they go from calling drugs deaths a humanitarian crisis to expressing horror at the Lord Advocate not wanting to criminalise users. Every single person I spoke to about in this issue who have lived with addiction or worked with addicts, and sometimes both, have all said the same thing. Criminalising users doesn't break the chain. I just don't see how talk of a legal right to recovery can be resolved with a determination to judge and jail users. I simply don't trust the motives held in this motion. It could be seen as cynically trying to use the death toll drugs are taken in our communities to attack the Scottish Government, while at the same time preventing and undermining many of the actions that would actually do some good. If the Tories were so concerned about the harms done by drug or alcohol misuse, why did they oppose minimum unit pricing for alcohol when alcohol was a bigger killer of Scots than what drugs was? Professor Sir Ian Gilmore, chair of the Alcohol Health Alliance, said of a recent research study by Newcastle University published in The Lancet, this is powerful, real-world evidence of the success of minimum unit pricing as a harm reduction policy. So just as the Tories in this chamber are trying to stop minimum pricing, their colleagues in Westminster are blocking drug consumption rooms, which we know can reduce the risk of disease transmission.
Mr Fairlie, if you could wind up, please.
Yeah, absolutely. My question is this to Dr Gilhany. How will he maintain the trust of his patients who present to him with the disease of drug addiction when he is going to vote to jail them for an addiction that may well be attributable to poverty policies that his party have imposed on Scotland's people
Thank you, Mr
for
Fairlie.
decades? Thank you.
Thank you.